Welcome back to Inside Healthcare. Vein disease is a common medical condition that can cause varicose veins and spider veins. Healthy's Vascular Center specializes in evaluating and treating vein disease, and we're very pleased to have back with us Dr. Kyle Wahlstrom with the St. Paul Surgeons. Thank you for joining us again. It's been a while since you've been here, so glad to have you back.
Thank you, Jody.
So who is at risk for vein disease, and what causes it, first of all, too?
Well, pretty much our whole population is at risk for vein disease,
Really?
and it's actually more prominent than a lot of people think. Actually, about 10 times more prominent than even cardiovascular disease. But it's really usually not diagnosed too early, and people don't usually seek help until they have more advanced problems. So it's usually shows up in people in their 40s to 50s, but a lot of times people will even start to have troubles in their early 20s to 30s.
And what does cause it?
Usually it's related to, first of all, is family history, so the old genetic problem again. So first of all, that. Second is jobs, standing jobs, jobs around your feet, wear and tear. Those are a big two. Third one in women is pregnancies. So pregnancies where we see a lot in young women, 20s and 30s. And even disease that shows up later on will start through pregnancy, actually issues that come along from that.
So what actually happens when it's, you develop, I mean, you can see the outside, but what's happening inside?
So what's happening inside is more about valvular problems. So we all have veins. Veins are tubes that bring blood flow back to our heart. But the veins in our legs are kind of unique. They have valves, kind of like our heart valves, but these are little tiny valves in these tubes in our legs. And they allow one-way flow, so flow up back to our heart. And the difference that happens with our diseased valves is that they break down. So instead of doing this one-way flow, they flow backwards. And it causes pressure to the next valve, which causes that one to break down. So it kind of sequentially progresses over time.
And does it happen in one particular area or is it kind of like the whole leg?
It can happen, you know,
in the body probably.
Yeah, I have that question asked all the time. Why is my one leg problematic and not my other? And it's just really by chance. There was some theories of right to left, but there really hasn't played out. It just happens, and it happens probably because of a breakdown of a valve higher up causes sequential issues down people's legs.
So you were saying that usually it's not detected early on. So what would be the symptoms? How would you know if you have vein disease?
Well, the biggest thing is people will see veins. So they'll see dilated veins, varicoses or varicose veins as we call them. They may also see spider veins on their skin. And those are visual cues that people get. Symptomatic cues people will get will pain, achiness, heaviness. And
like a sharp pain? Or?
Well, it's usually dull pain. It starts with more of dull achiness. And people will talk about it as they progress through their day. They'll get this dull achiness that progresses through the whole day and doesn't get relieved till they get up off their feet at the end of the day. So that's kind of a telltale sign. It may be more so better predictor of problems than actual visualized issues that people have.
Is there anything you can do to prevent them?
There is. The biggest things that we talk about our patients are staying active and exercise. Exercise, like everything else in medicine, is key.
Keeps those valves working?
Yep, keeps those valves. Actually, what it does is it strengthens the surrounding tissue, the connective tissue, which helps them get better return. The other thing that helps a lot is in pregnancy for women or in jobs where you stand all the day long is wearing compression hose or stockings. So that's the biggest key, I think, for helping prevention. The other is catching problems early. I think that a lot of times in our society we've always said, well, if people have veins, just live with them, they'll get better.
Really?
Or you know, they're not as big an issue as you think. But I think getting on top of it earlier is better for people than waiting until they become a big problem. You
know, and I don't know if I really know the difference between the varicose and spider. What's the difference between the veins?
The difference is the spider veins are in the skin level itself, so they're actually part of the dermis. So they'll actually be these little tiny purple or red lines, very small, usually less than a millimeter in size, and they always kind of look like they emanate from a center. Varicose veins are dilated veins, bigger tubes underneath the skin, which will be those big bulgy things we see. Yeah.
So you have a number of new treatment options that are available. What are some of the latest treatment options available for it?
As a vascular surgeon, I always worry about the big problems first. So we look at the whole person first, you know, evaluate them, look for other issues of vascular disease, whether it be arterial and things. But once we do that, our treatments really focus on treating those big issues first. So we'll do an ultrasound to evaluate people's legs first. Once the ultrasound is obtained, if we can do it, we like to do endovenous techniques, which is nowadays we'll use like small catheters put inside broken down vessels. numb them up and seal them right in the clinic instead of doing hospital-based surgical procedures.
So something very simple and
Simple,
short.
yep. That's probably the biggest, newest thing. It's not that new anymore. It's been around now about 12 years, so we've used those techniques. We use either radiofrequency or laser energy to seal those vessels. And it's nice because patients go back to work and life the next day. It's much different than 20 years ago where surgery laid people up for 2 to 3 weeks. We still need surgery, and we still do surgical resections, but it's less and less.
And that's treating the inside problem. What about the visual, the appearance of it?
Yeah.
I know that that's a concern with a lot of people.
It is, and the two modalities that are treated most often nowadays are laser treatments. So small veins can be treated with lasers, and what it does is it basically ablates that vessel by heating it to a very high temperature.
So it just kind of zaps it?
Kind of zaps it. And it works really nice for people, but it takes multiple treatments and multiple therapies, and it doesn't always just happen overnight. So people have to be kind of set up and ready for that. And in a similar method, we also use scleral therapy, which injects a chemical and causes a chemical reaction or burn to that vessel, which seals it off. And that's also kind of multiple therapies and multiple modalities. Yeah.
What about pain associated with either of the treatments? Or?
There is minimal pain for all of these outpatient kind of clinical-based procedures, usually done with just local anesthetic, or even just as we do for laser treatments, we use cold therapy. So we'll actually kind of almost freeze the tissue area we're working on, and that'll kind of make it so that it's almost anesthetized that way.
So let's say someone is watching this right now. Can they get treated this month, and by summer, varicose veins are gone and their legs are looking great? And
It'd be nice. But insurances have changed now, so most insurances require 3 months of socks to be used before we can actually start treatments. So that kind of delays a lot of people's treatments. So that's one part.
So maybe by the end of summer?
Maybe by the end of summer. But yeah, it's something that if you want to start to think about the summertime, now is the time to think about it because of that process. Other than that, yeah, we have a bunch of availabilities of clinic positions. We have a vascular center at Maplewood, Woodbury, and also downtown in the Gallery building next to St. Joseph's. And
you're going to have some free screenings or a free screening coming up here?
We do. In April 1st, we'll have a free screening at our Maplewood clinic. What we'll do there is that people can come in, be evaluated by a physician. We'll take a look at your legs, give you some recommendations. We can't actually do as far as book an appointment or things of that sort, but we can do we call a screening where you just take a look, give some options, talk about things that are available, kind of similar to this talk we have in right now, and then give them the materials if they want to come back and take a look at it from a medical standpoint.
And is that something with the ultrasound then that you're doing the screening? Or?
We don't do ultrasounds at the screening, yeah, but we do ultrasounds through the clinic.
So what's the main thing that you want viewers to know about varicose veins or spider veins?
I think the best take-home message is there are things that can be done. I think that treatments should be sought maybe earlier than later because we can do things and make a big difference earlier on. And prevention is the biggest key with exercise and stocking use.
You know, I just thought of too, so if it's not treated, what happens?
If it's not treated, you become one of my chronic patients, which you don't want to be. And ulcers. Ulcers are the biggest thing we see happening, and we all probably know somebody who has chronic lower leg wounds or ulcers, and they're a lot of times related to venous pressure. And that becomes a lifelong problem and a very difficult problem to treat. So we want to get way before that aspect or point of treatment.
All right. Well, it's a pleasure to have you back with us.
Well, thank you very much.
Always glad to have you here, so thank you.
Thank you.
Great. Good to see you again.